Good evening. My name is Ruth Ann Rigby, and I am co-founder of First Responders of Mississippi. And tonight, along with the Mississippi Nurses Association, as you know, we have brought back our series, and this is Thriving and Surviving series that we wanted our healthcare providers to be a part of, and of course, our first responders. And tonight we are very excited to be able to have Dr. Coletha Colley with us, and she's got a great presentation for you. But first, just few helpful hints is the session will be recorded, and tomorrow it will be uploaded to our website, because we know that these are often used for educational purposes, for trainings and things like that within your hospital or your clinic or your police precinct or your firehouse, because it's great information. You know, through this initiative with the Mississippi Nurses Association, we have been able to reach over 3,000 first responders and healthcare providers. And so this is specifically for you. And actually, it's open for anyone to participate. And so just always invite your friends and colleagues to join us. And like I said, tomorrow you'll be able to go back to the website and watch this presentation, but you can also go back and watch previous presentations that we've done in the past. Also tonight, please post your questions in the chat box, and we will, after her presentation, we will do a Q&A question and answer. And we're just really honored to have Dr. Coletha Colley tonight. She is a dear friend of my husband's and I, and she is married to Captain Marcus Colley with the Mississippi Highway Patrol. So she is also a first responder wife, as well as a clinician. And we're just very honored to have you, Coletha. And I'm going to turn it over to you. Thank you for being with us.
Hello, everyone, and thank you for this opportunity to present on such an important topic in this safe space. My topic is surviving adolescence in a COVID world. So I want to start off by saying I'm hoping from this presentation, some of this information will resonate with you, so that when you start looking at your child again or working with your child again, you'll reflect on some of the information that was presented tonight. And then you decide if your child is okay, or if you need to seek additional assistance or help for your child. So with that, we'll get started. So I want you to think about, take this moment right now and think about the current grade that your child is in, which is listed on the left side of this chart. And then on the right side, it shows the last normal grade that your child experienced. So for example, my youngest child is currently in the 11th grade. His last normal school year was his 8th grade year, which is correct, because the 9th grade year, second semester, is when COVID occurred. So just think about that for a minute, how long that has been. So I want you to do just a paradigm shift. I want you to think about the COVID-19 pandemic as a crisis, because actually that's what it is. Let's look at the definition of a crisis. A crisis is an event of limited duration that is typically unpredicted and overwhelming for those who experience it. Let me read that again. A crisis is an event of limited duration that is typically unpredicted and overwhelming for those who experience it. So based on that definition alone, I want you to think about these questions. So is the COVID-19 pandemic, is it considered to be a crisis? Why or why not? Was it a limited duration? It's still going on. Was it typically unpredicted? Yes. And was it overwhelming for those who experienced it? Yes. So who's being affected by the pandemic? The question to that is, or the answer to that is, everyone is. No one is excluded from this pandemic. Children, adults, and adolescents, everyone is. No one has been exempt from this crisis. So with that being said, where should our focus be? What do we need to be looking at as far as how to help our adolescents, because our focus tonight is working with adolescents. During times of uncertainty, it is crucial to focus on mental and emotional well-being. The responses of adolescents to a crisis depends upon their prior exposure to emergency situations, physical and mental health issues, the socioeconomic circumstances of the family, and their cultural background. All of those different variables determines how well an adolescent or child will respond to a crisis. And again, COVID-19 pandemic is considered to be a crisis. Common problems that adolescents have experienced or endured during the COVID-19 pandemic crisis are anxiety, depression, distraction, irritability, fear of family members contracting the disease, and feelings of hopelessness. Okay. Now, parents, and I'm guilty of this myself, initially, I didn't know how to handle or some of the signs of COVID affecting my child. So I'm guilty of some of these too. Some of these perceptions as a parent is my child is failing. My child has been getting into trouble at school and or at home. My child does not want to go to school, because for us, that's what we're seeing. We're looking at the physical actions of the child. My child is just so emotional. They may be crying a lot. My child's behavior has been so extreme. My child stays up all night. My child always complains of his or her stomach hurting. My child is being defiant. My child stays in his or her room and doesn't socialize with the family or friends. Again, that was our perception, just looking at our child's behavior, physically looking at them, not knowing that on the inside of them, they're experiencing the depression and anxiety, the feelings of hopelessness. Something common I heard parents say once we were returned to the schools being open was, my child has just lost their mind. They don't want to go to school. I don't know what's going on with them. But they really didn't sit down and look at how the pandemic was truly affecting their child. So it's not just something just wrong, that they're just acting out or their behaviors are changed. Something is wrong. Something has happened. And all of that fits the definition of crisis. So the consequences of a decline in mental health can lead to engagement in unhealthy behaviors. So the anxiety, the depression, the feeling of hopelessness. Some kids turn to substance abuse. Some, it results in absenteeism from work, absenteeism from school, or truancy, self-injury, and suicide. So for me, being a school social worker, what I truly see, I'm seeing the substance abuse. There has been an increase with marijuana use. Believe it or not, initially it was vaping. Now it's marijuana use. And I'm at a 7th and 8th grade school. So we have 12, 13, 14-year-old kids using marijuana. Self-injury has increased. Last school year, when we first started, kids were excited to return to school because they had been out of their norm, out of their routine for so long. So initially, I did not see the self-injury, but slowly, as the school year started to progress, we had more and more kids cutting themselves. And some of their self-injury was so bad, I would have to call a parent to tell them they had to come pick their kid up and take them for immediate medical care, or to take them to get a mental health assessment, because self-injury is a cry out for help, that something is wrong, something's going on with your child. And unfortunately, suicide, we've all heard suicide numbers are increasing. So these are some unhealthy behaviors as a result of them feeling the depression, the anxiety, the feelings of hopelessness. So then the question comes, okay, as a parent, what can I do to help my child? And these are some simple things you can do. Pay attention to your child. Talk to your child. Acknowledge your child's feelings. Don't minimize your child's feelings. If a child is telling you they're sad, I've experienced this school year alone and last school year, depression is a big word. That's a quick, easy word that students use to label their feelings. I'm depressed. So my job is to dig a little more and to figure out exactly what is going on, for them to define their depression, how long they've been feeling like that. And if it's truly a sign of depression, then I to refer them to an outside resource for some clinical help. Allow a safe space for your child to talk. That is very important. For my family, COVID really taught us that we had a lot of time to spend together, and I'm sure you experienced the same thing. So we started incorporating a lot of family dinners. And during that time, that was a safe place for us to explore both of our sons' days to see what was going on, what was good about it, bad about it. So it's important to establish that space. Even before our youngest goes to bed, he would come in, and during that time, that was our time for us to have that, just our time together so we could sit and talk about his day. So they knew that twice a day, they had an opportunity to talk to us about their personal feelings. It was during dinner and then right before he went to bed. Another, reassure your child that you are there for them. You're your child's biggest advocate. Your job in his role as a parent is to advocate for your child and to protect your child. Let your child know that, not just saying it, but your actions shows your child that you're there to protect them. And if they feel that way, they're going to come to you first if they have a problem. So your job is to reassure them, we got this. I'm going to help you with this. You don't have to go through this alone. I'm here for you. Your child may need additional affection in the form of hugs and other physical contact. We all know physical contact is so important. It's one thing to say, I love you, but just that hug and that touch and saying, ooh, that bear hug, I truly love you. We know what physical contact can do, just a touch of to someone. Stay in touch with your child's teacher to monitor his or her academic and behavior performance. Again, that's a huge red flag. The school, your child spends a lot of time at school. So if you start having concerns about your child's academic and behavior performance, talk to your child's teacher about it. If you're seeing problems at home, inquire with your child's teacher, are they seeing the same thing at school? If they're seeing the same behaviors, then that's a red flag that I may need to give my child some additional help. Something's going on here. Spend more time with your child. That is very, very critical. Your child needs to know that you are there for them. They need to know that you're there to protect them no matter what's going on with them, that you're going to be there to help support them and help them through their problem. Monitor your child's friends. That's another important one. Friends can either influence your child to do something bad, or they can influence them to do something good or to have appropriate behaviors. So if you notice that your child is starting to make some poor decisions, look at the friends that they're hanging around. Monitor what they're doing. And when I say friends, that means on social media, texting, hanging out with. You need to know who your child's friends are. One thing that COVID has introduced us to has been this virtual world. Our kids have really used that to their advantage, and they're talking to people in other countries. So you don't know who your child has befriended, who your child is talking to. So that is important for you to monitor their social media use. Look at who they're texting. See who they're hanging out with. You play that vital role because your ultimate role is to be a parent, to advocate, and to protect your child. Monitor your child for increased use of alcohol and drugs. Again, as I stated, I'm 7th and 8th grade school. I never thought in my lifetime that I would have to worry about drug use with 7th and 8th graders. And again, we're talking about 12, 13, 14-year-old kids, and we are. Weekly, we're having kids who are being busted with drugs. They're even using at school. So now we have to ask ourselves, what is going on? What is it that is going on so badly, or is affecting these kids so badly that they're taking a chance to use drugs at school, to get busted, and to suffer a severe consequence? Are they just seeking help? Are they doing it at school because they know a school social worker is going to have to talk to them, or a counselor is going to have to talk to them? We're going to have to go in and talk with their parents. We're going to have to put a plan in place to figure out what is going on. So please make sure you're monitoring your child. And if alcohol and drugs become an issue, please get some professional help. When should your child receive additional help in the form of professional intervention? When your child continues to exhibit high levels of emotional responsiveness after most of his or her peers have discontinued to do so. An example of that is when COVID first occurred, we didn't know what to do. It was like a knee-jerk reaction, trying to figure out what to do, how to handle it. So that was normal. But if months down the line, if your child is still struggling with COVID, if their behaviors had not resumed to some natural state of equilibrium of how they were before COVID, then that's a red flag to say, I think I may need to talk to someone about my child, because they're not acting like their peers act. They're still crying. They still have this fear of going to school. So that's a red flag. Your child appears to be depressed, withdrawn, and doesn't communicate. That's another reason to get professional help. Depression or withdrawal alone. If your child's behavior before COVID, where they were social, outgoing, interacting, and then now they're still withdrawn, depressed, don't want to go to school, failing, that is a red flag that your child needs some help. Your child continues to exhibit a drastic decline in academic performance. At school, we always look at academics and behavior. If your child was doing well academically before COVID, the pandemic occurred, and now their grades have tremendously dropped and they can't seem to climb themselves out of that hole, that's a red flag. Your child expresses suicidal or homicidal ideation, or your child is intentionally hurting him or herself. So that alone, that slide alone, if your child has stated that they want to hurt themselves, if they want to hurt someone else, they have a plan to carry it out, you need to get professional help as soon as possible, like ASAP. If they're intentionally hurting themselves, again, like I said, cutting has drastically increased, especially at my school. So sometimes it's superficial, but sometimes it truly is they're trying to hurt themselves. You need to seek professional help. You cannot do that alone. You cannot solve that issue by yourself. You need someone with the skill set who's been taught to deal with that problem. You need to reach out to a professional. Your child exhibits an apparent increased use of alcohol and drugs. That goes back to, like I told you, the increase of marijuana, or you slowly see, I know prescription drugs have been used. Those things, that goes with closely monitoring your child, so you'll know when their behavior has been altered. They're acting out of sorts. They're not acting out of their normal selves. Alcohol is another thing. We have not had a lot of experience with alcohol the past 2 years, but marijuana, yes. Your child gains or loses a significant amount of weight in a short period of time. That's another red flag, because it is not normal for someone to either gain or lose like 5 or 10 pounds. I'm gonna say 10 pounds within like 2 weeks. That's a red flag. Something's wrong. Your child exhibits significant changes in behavior. Again, if they were calm, or they were, your child's behavior pattern. And then all of a sudden, it has drastically changed, and it doesn't resume back to that normal behavior pattern that you're used to seeing. That's a red flag. Your child discontinues attending to his or her hygienic needs. Believe it or not, for me, that's a red flag. And that's, for me, being at a junior high school, that's one of the first things I can quickly do, a physical scan just with the naked eye of a child. For example, I had a child a couple of weeks ago. This girl was always intact. Makeup always on point, hair always done, always wore best clothes, everything. Then about a week or so later, out of the blue, she was completely different. Her hair wasn't groomed. She didn't have on makeup. Her nails wasn't done. I pay attention to everything. So I knew something was wrong with her because that was just out of the norm, out of character for her. So I immediately contacted her parents and something was going on with her. And we were able to get her to where she needed to be. Your child, so professional interventions. So everything that I just talked about, number one, make sure you're, like I said, monitoring your child. You know your child. If you have a concern that something's out of sorts, something just not right with your child, the first thing I always tell my parents is, I ask, do they have a pediatrician? If they do, talk to your child's pediatrician or doctor. They will guide you in the right direction. Another resource is your child's school social worker. I'm a school social worker, or their guidance counselor. If you're seeing behaviors, changing in behaviors at home, follow with your child's school to say, hey, I'm just seeing this. I'm concerned. Are you seeing the same thing at school? Even if they don't have a change of behavior or academics at school, if you're just concerned period about what's going on at home, your child's school social worker or counselor can point you in the right direction, can give you some resources to some agencies that can help you with that. Another intervention, local community mental health agencies. And then the Mississippi Department of Mental Health, they have a wealth of resources available for you. You can contact them at any time. You can call or go on their website, and they can also help point you in the right direction. Are there any questions? Does anyone have any questions about anything?
Well, Dr. Colley, we have been sent some questions. That's the beauty of this, is they have our cell numbers, so they just send us questions directly. You know, we have seen so much in our youth in the last 2 years, the good, the bad, the ugly, and all in between, and the struggles are just so real. The first question that I have is, what are some of the specific signs of depression in teens?
So the first thing that I've noticed is their lack of socializing with their peers. So if they were outgoing and then all of a sudden they do not want to do anything, they don't want to be around friends, that is a red flag. Something is wrong.
Okay.
So I just look at any change in behavior, because anyone can wake up and be in a bad mood. That's normal. I make up sometimes in a bad mood. I know, Ms. Ruth, you do too. But if it's continuous for days and they're still in this bad mood, and you just like, and you're good as a parent, and you just say something's just not right, you need to follow up with your child's doctor or school and say, I'm concerned about my child. This is out of character for them. This is not like them. And say, just seek assistance or help for that.
And it's very hard when it's in your own backyard. When you're a healthcare provider or a first responder, it's hard for families in general to navigate, but it's really hard when it's in your own backyard. I know for us, when we've had crises within our own family, you know, we have to let somebody else take the ball and run with it, so to speak, because it's too close to us. And so it helps to get another set of eyes or another person's opinion on it, like a physician or a counselor or therapist, you know, somebody who can take that ball and run with it. Are there non-pharmacological ways to treat anxiety in teens?
It is. I'm not a big advocate of meds, but I do know that in some situations you do have to have medicine. But I always couple that with some type of therapy. You have to work on changing the behavior. You have to learn some type of techniques in order to deal with certain situations. So I'm not going to say that question I can answer two ways, yes and no. But I always, regardless, you have to have some type of therapy to go with in order so your child can learn coping skills and be able to use those coping skills in anxiety-driven situations.
Do you think that social media platforms have had a negative effect on our teens? You know, it's just such it's a beast. As a
school social worker, I hate social media. for kids. You will have a small percentage of kids who actually use social media in the correct way, but the majority do not.
Right.
Do not.
And that's a whole nother presentation on the
Yes.
social media dangers. And, if that's something that y'all would like to see at another presentation, we can certainly put that together before you, because, that leads to so many different avenues. What are you seeing in the schools with the bullying issues?
For me personally, our guidance counselors deal with that. So whenever a student does report bullying, we have to investigate. It has to be investigated. They do incident statements. They bring in the victim as well as the perpetrators, and it goes on record. That's for our school district. It has to be investigated.
So this is another question. So with everything that y'all are doing in the school systems and things of that nature, how do you practice self-care?
Oh, that is so hard. Yeah, and as a social worker, just basic social work one-on-one, we've been taught that to avoid burnout, you got to take care of yourself. But it is so hard because you're always, even as just being a parent, you put your kids before yourself. Ms. Raby, you put your fur babies before yourself. So that is a very, it's easy to talk about, but it's hard to practice. So literally just yesterday, I told my husband, I said, when all of this COVID stuff is over, we're going on a cruise. So guess what? That may be next year. I need to do something right now.
Right.
So it's just hard. I have not, I haven't figured it out yet. I haven't mastered it. I'm just going to be honest with you. I haven't.
Yeah. Well, I think that's something for us as providers, no matter, or service people in general, that we face on a day-to-day basis, because our workload is doubled, especially for our nurses in our hospitals. They're short-staffed, and there are heroes, and I just always like to hear how are people practicing self-care. That's something that's also a challenge for me, but I also know when I'm getting ready to plateau that I have to take those days off and do what I need to turn my phone off and do all those things, and just be present for my family. Have you ever had a situation where the children are struggling, but they're also running their household and their parents are fearful of them? Have you ever encountered that?
Yes, I had that today.
And what is your advice when that happens?
I encourage parents to set boundaries. I tell them that they're the parent. They have a right to discipline their child. But when you're talking about a parent who's fearful of their child, that's a different story, because they're not going to enforce rules. They're not going to enforce expectations. So then we have to have a different conversation that if your child becomes violent, then you need to call the police. We have to, that conversation takes a different route. So that's a hard and difficult conversation, because at my school, you're talking about 12, 13-year-olds whose parents are afraid of them.
Right. Yeah.
They run the house.
One of the things that you pointed out were the great resources the Mississippi Department of Mental Health has, and they do, and they also have mobile crisis teams strategically placed throughout the entire state. So if there's ever an emergency, for example, at your house, you can call the crisis team and they will send a team out that, will do an assessment on site. And if they're a danger to themselves or other, or anything like that, they will go to the hospital or the stabilization unit. And that's one of the greatest gifts that we have in our state that we can utilize for, parents that have school age children and things of that nature. So there's a lot of resources out there. If you are watching this today and you want additional resources, all you have to do is reach out to us at the Mississippi Nurses Association. You can call Dana or Teresa, or you can reach out to us at First Responders of Mississippi and send us an email through our website. We have a lot of resources. We have a lot of partners throughout the state, but also out of state as well. And the most important thing I want to encourage you, if you are struggling or you have a friend struggling, a family member struggling, a child struggling, you don't know what to do, please reach out and ask for help. And so, Dr. Colley, thank you so much for being with us this evening. And thank you for being a first responder wife. And we're partners. So we were both married to troopers. So we know what that life is like for that. So thank you to all who joined us tonight. And don't forget that you can also go back tomorrow to the Mississippi Nurses Association website and view this and other presentations at any time. So we hope you'll join us next week. And until then, have a nice and safe weekend. And if you're on spring break next week, enjoy your spring break.